So we're left with talking about this as a mental illness, and that's what we're going to focus on. And I'm going to show you a picture of a rat brain, and over on your right is the frontal cortex, and in the back is the hindbrain, and the demon here is where that purple arrow is. That's a location called the Nucleus Accumbens, and that is the part of your brain that responds to the pleasure drug, which is known as dopamine. And dopamine causes both craving and reward. So when you walk past a bar, a dope house, a pastry shop, whatever it is, and you get that urge to do something about it, that's dopamine. And when you do it and you feel that reward, that's dopamine again. And the gas tank for dopamine is right behind the nucleus accumbens. It's called the ventral tegmental area. And if you look at the list over on the right and the bottom, all the drugs of abuse that we talk about either directly or indirectly feed into the nucleus accumbens by causing craving and causing reward. And another area is the prefrontal cortex, which is the part of the brain that is supposed to put on the brakes. I'm going to sit down for a sec. So those of you who go to a bar tonight and have 1 or 2 beers and say, I don't want to get arrested on the way home, I'm going to leave, that's your prefrontal cortex telling your nucleus accumbens to stop. And that's how it normally works. You control any impulses. In addiction, I'm going to show you how these areas of your brain are broken. This is a normal brain. Imagine yourself looking down at somebody's head, and their cortex, the front, is pointing up, and they have a left side and a right side, and what you're looking at, that yellow and red area, is their nucleus accumbens. That's their pleasure center. And the red you see is dopamine. And this is what a normal, happy, healthy brain is supposed to look like. And this is a research study done by Dr. Nora Volkov, who's the medical director of the National Institute of Drug Abuse. And she took 3 normal, happy controls, and you can see their brains on the left-hand side. That's how you're supposed to look. And then she took a cocaine addict, an alcoholic, and a heroin addict, and took pictures of their brains. And you can see they all share one thing. They've run out of dopamine. And even though it's different drugs, it's a common pathway. And that's one theory of addiction. It's called the reward deficiency syndrome, that addicts and alcoholics run out of dopamine, they feel terrible, and they spend all their time trying to catch back up by doing things that give you a lot of dopamine. So instead of watching TV, they use heroin. And it sounds ridiculous, but that gives you a bigger burst of dopamine than any natural activity will.